Open your mouth. That is the phrase I say more often than any other. I am Dr. Emily Roberts. I am 46 years old. For 15 years, I have owned a private dental clinic in downtown Boston, and it was in my own treatment room that I met a patient who was 58. This is the story of our love. It started in a dental chair. Hello, my name is Emily. I am 46. I own Emily's Dental Studio in Boston for 15 years now. I am a widow. My husband Andrew died 4 years ago from lung cancer. I was 42. He was 45. After his diagnosis, he survived 1 year. That was the end of our 18 years of marriage. After Andrew died, I buried myself in work. When you are working, you don't think. From 9 in the morning until 7 in the evening, 20 patients a day on average, cleanings, cavities, root canals, implants. In 15 years, I have treated thousands of patients. I have a daughter, Anna. She is 24. She is in graduate school. She lives in a dormitory, and I live alone in our apartment on Beacon Street, 1,000 square feet, the home where Andrew and I lived. In the evening, it is lonely at home, but I am used to it. 46 years old, dentist, widow, mother. That was all I had. I did not think about love, treating patients, going home, sleeping. That was my life. But meeting that patient changed everything. The channel is called Real Love Stories, where we talk about true love that overcomes age and circumstances. Today, I will tell you a warm story that began in a doctor's office. Please subscribe and like. Here we go. 9 in the morning. I opened the clinic. 2 nurses had already arrived and were preparing. I checked the treatment room, sterilized the instruments, reviewed patient charts. The first patient walked in. Appointment for a cleaning. I asked him to sit in the chair. The patient lay down. The chair slowly reclined. I turned on the light. Bright light flooded the patient's face. I put on my mask and gloves, looked into his mouth. Open your mouth, the most common phrase. The patient opened his mouth. Everything visible, teeth, gums, tongue, one of the most intimate places. I removed tartar with an ultrasonic scaler. With a sharp tip, I cleaned between teeth and gums. The patient flinched. If it hurts, raise your hand, I said. 15 minutes of work. Next patient came in. Cavity treatment. I prepared the anesthetic. A long needle. This will hurt a little, please be patient. I injected into the gum. The patient flinched. I slowly injected the medication. The gum swelled. I waited 5 minutes, checked if it worked, turned on the drill. Buzzing. The scariest sound for patients. I drilled out the cavity. The black was gone, a clean tooth remained. I placed a filling, packed it. 30 minutes of work. Lunch. I ate with the nurses at a cafe nearby. 30 minutes of rest. In the afternoon, the flow of patients never stopped. Root canals, crowns, implant consultations. No time to breathe. 15 years in a row like this. But I am used to it. When I am with patients, I don't have time to think about other things. Loneliness and sadness are forgotten. 7 p.m. The last patient left. I cleaned the treatment room, disinfected the instruments, organized the charts, checked tomorrow's schedule. The nurses had left earlier. Alone in the room, I turned off the light and left. At home, an empty apartment was waiting. I had dinner alone, watched TV, went to sleep. That was my life. 46 years old, dentist, widow, that's all. The second Thursday of January, 7 p.m. I was getting ready to leave. The nurses had already left. The phone rang. An emergency patient, they said. The tooth hurts so badly I can't stand it. Can I come now? I asked where he was. He said nearby. He would be there in 10 minutes. I agreed. I quickly called one nurse and asked her to help with an emergency patient. 10 minutes later, a man walked in. He looked around 60, about 5'9", wearing a suit. His face twisted with pain. He held his cheek. I asked him to sit in the chair. The man lay down. I reclined the chair, turned on the light, put on my mask, looked at his face. A middle-aged man in a suit. Some wrinkles, but neat. Where does it hurt? The left molar, he said. His voice was trembling. You could see he was in a lot of pain. Open your mouth. The man opened his mouth. I examined it. A large hole in the left molar. Almost black. It looked like it had reached the nerve. He had neglected it for a long time. The nerve was inflamed. Very painful. Yes. The man nodded. His face was contorted. First, I provided emergency care. I gave an anesthetic injection. This will hurt. I injected. The man flinched. I administered the medication, waited 5 minutes, checked, and started drilling. Buzzing. The man closed his eyes and endured it. I removed the nerve. Bleeding pulp, a little pus. I disinfected it and placed a temporary filling. 1 hour of work. The acute pain was gone, but I explained that he needed to come several more times. To fully treat the canals, 4 or 5 visits. I added that his overall dental condition was poor. 3 molars missing on the right side. He needed implants. The man agreed. We scheduled the next appointment, next Thursday at 6 p.m. The man stood up and bowed, thanking me. He said he thought he was going to die from the pain, and I saved him. It was nothing, I said. See you next week. The man left. Alone in the room, I filled out his chart. Name, Victor Morrison, 58 years old. Profession, company director, that was all. Next Thursday, 6 p.m. Victor arrived. On time. He lay in the chair. Second stage of root canal treatment. I put on my mask, looked into his mouth. Open your mouth. Victor opened it. I removed the temporary filling, cleaned the canals. With a thin file, I went along the canal walls. Rinsed. Placed another temporary filling, 40 minutes of work. After the treatment, we talked. I explained that he needed 2 more sessions for the canals and reminded him about the 3 implants on the right. I told him about the cost and timeline. Everything would take about 6 months. Victor agreed, said he would do it. I asked if he was busy. Being a company director, he said it was fine. He could free up Thursday evenings. He would delegate to his staff. We scheduled every Thursday at 6 p.m. Victor cautiously asked, "Doctor, are you married?" I was taken aback. Patients rarely ask that. I answered that I was a widow. Victor apologized. He said it was tactless. I said it's fine. Victor also told me about himself. Divorced 8 years ago, has a 30-year-old son. Married, lives separately. Any grandchildren? He asked if I lived alone. I said yes. Work, home, that's it. He said it was the same for him. Victor smiled. Above the mask, I could see his eyes. A warm look. He said, "See you next week," and left. Alone, I thought. He seems like a nice person. That was my first impression. After that, Victor came every Thursday at 6 p.m. He never missed an appointment. Always on time. By the end of January, we finished the canals, 4 visits total, each time cleaning, disinfection, filling. On the 4th time, I filled the canals permanently and placed a crown. The canals were done, but the implants remained. In February, we started the implant surgery. 3 teeth on the right, 1 at a time, the day of the first surgery. Victor looked tense. He said it was his first time getting an implant. I reassured him. I said everything would be fine. With anesthesia, it won't hurt. I gave several injections until the entire gum was numb. Victor's lips swelled. I checked sensitivity, made an incision. Blood appeared from the scalpel. I wiped it with gauze, drilled into the bone. The sound was loud. Victor squeezed his eyes shut. I screwed in the implant, a metal screw into the bone. I stitched the gum. 1 hour of work. 2 weeks later, the second surgery. 4 weeks later, the third. By the end of March, all 3 were placed. Now we had to wait for the implants to heal. I explained that this would take 3 to 4 months. During this time, he needed to come once a month for a checkup. Victor agreed, but he looked disappointed. He said, "It's a shame we won't see each other every week." To be honest, I was also sorry. After each appointment, we talked first about teeth, but gradually moved on to other topics. Victor's company. He has a small auto parts manufacturing business for 30 years. He said he had been very busy. He regretted neglecting his teeth. I told her about myself, how I opened my clinic 15 years ago, how hard it was without patients. But now everything is stable. Victor said it was amazing, a woman running a clinic alone for 15 years. That is not easy. It was nice to hear. In February, our conversations became longer, 30 minutes each time. Victor told me about his divorce. He divorced his wife 8 years ago due to incompatibility. His son stayed with his mother. After his son got married, he sees him rarely. He said he was lonely, alone in his apartment. I also told him how my husband died of cancer, how he fought for a year, how hard it was to watch. Victor nodded and listened. He said it must have been very hard for me. I said I was also lonely, alone at home. Victor took my hand for a moment. It was warm. April arrived, the healing period for the implants. He needed to come once a month. First Thursday at 6 p.m., Victor came. We took an X-ray. The bone and implants had bonded well. I said everything looks excellent. Come back next month. Victor looked disappointed. Doctor, we only see each other next month? Yes, while it heals, we cannot touch it. Then he said, maybe we can have dinner together? I hesitated. Dinner with a patient. But Victor's gaze was serious. I agreed. We went to a nearby Italian bistro. We ordered pasta, ate, and talked. Meeting outside the clinic felt different. Victor was without his patient mask, in a way, or I was without my doctor's mask. I could see his whole face. At 58, he was handsome. He had wrinkles, but his eyes were clear. Victor said, I liked you from the first time I saw you. Your eyes above the mask were very beautiful. I blushed. At 46, I hadn't heard something like that in a long time. I said I liked him too. Victor smiled. After dinner, we walked to the parking lot. Before saying goodbye, Victor said, I want to see you not only at appointments next month, if you don't mind. I said I didn't mind. In May, we met once. Dinner after the checkup. In early June also. Before we knew it, we started meeting twice a month. Once at the clinic, once at a restaurant. Mid-June, Victor's implants had healed. Only the crowns remained. I explained that the crowns would take 2 weeks to make. Next week, we take impressions, and the week after we place them. Victor agreed, but looked sad. The treatment was ending, and he would no longer have a reason to come. That evening, Victor asked if I was free this weekend. I said yes. He suggested we go for a drive. The weather was nice. I agreed. Saturday morning, Victor picked me up in his car. We drove out into nature, to the Atlantic coast. We chatted in the car, listened to music, and after 3 hours we arrived. We could see the ocean, blue ocean. We walked along the beach. The wind was blowing. Victor took my hand. The hand of a 58-year-old man was warm. He didn't let go. We walked together, sat in a cafe, drank coffee. Looking at the ocean, Victor said, thanks to you, I fixed my teeth and my life got better. I understood what he meant. I said it was thanks to him. For 4 years, I was lonely, and now I am happy. Victor squeezed my hand tighter. Emily, I love you. I caught my breath. At 46, to hear such a confession. Even my husband never said that when we were dating. I love you too, Victor. Victor hugged me. The embrace of a 58-year-old man was warm. We stood hugged for a long time, looking at the ocean. End of June, the last day of treatment, I placed the crowns, perfect. Treatment is complete. Take care of them and they will last a long time. Victor looked in the mirror and smiled. He said, excellent, all thanks to me. It was nothing, I said. Take care of your teeth. Victor stood up from the chair and looked at me. Dr. Roberts, now I am not a patient. I understood. Yes, no longer a patient. Then I can confess officially. But you already confessed by the ocean, I said. Victor laughed but said again, officially? Victor got down on one knee right in the treatment room. Dr. Emily Roberts, will you be my girlfriend? Tears welled up. For the first time at 46, a moment like this. Yes, with pleasure. Victor stood up and hugged me in the treatment room, not as doctor and patient, but as a man and a woman. After that, we became a couple. We still met every Thursday, but now it was not treatment, but a date. Victor did a lot for me. Restaurants, theaters, trips. Dates with a 58-year-old man were attentive. He remembered what I loved. He remembered what I didn't love. One weekend, he invited me to his place, a luxury apartment in downtown Boston, spacious but empty. You could tell he lived alone. Victor cooked himself. He grilled a steak. It turned out he cooks well. He learned living alone. We had dinner, drank wine, talked about Victor's company, 30 years in business, hard times, stability. Then I also talked. 15 years of my clinic. How I survived alone after my husband died. Victor took my hand. Now you are not alone. I am here. Tears flowed. For the first time in 4 years, someone said they were there for me. Victor hugged me and cautiously asked, will you stay tonight? I nodded. That night we became one, 58 and 46, 12 years apart. We started as doctor and patient, but now just a loving man and woman. Victor turned out to be amazing. I couldn't believe he was 58. He took care of his health, so he was in shape. Gentle but passionate. Victor kept telling me I was beautiful, that at 46 my skin was like a girl's. I blushed. In 18 years of marriage, my husband never said anything like that. But Victor was different. He kept saying I was sweet, beautiful. The night lasted until morning. In Victor's arms, I felt like a woman for the first time. I am 46, but I am not old. I can be loved. I can be happy. July, August, 2 months passed. We were happy. We spent weekends together at his place or mine. We cooked, watched movies, fell asleep together. 58 and 46, 12 years apart, but we were just two people in love. Victor always took care of me. I was tired from work. He gave me a massage. I was tired. He cooked dinner. When lonely, we talked on the phone all night. I also took care of him. I listened about his stress at work, asked him to take care of his health, get checkups. We took care of each other. The love of a 58-year-old and a 46-year-old was quiet but deep. One weekend, Victor said, I want you to meet my son. His 30-year-old son felt it was time. I also said I wanted him to meet my daughter, 24-year-old Anna. Victor smiled. Let's date openly, without hiding. I agreed. But I was anxious. The nurses at the clinic did not yet know that Victor was no longer a patient. How much longer to hide? The first week of September, Thursday evening. After work, we agreed to have dinner. Victor came to the clinic waiting in the car. I went out and got in the car. Victor put his hand on my shoulder. I turned around. The nurses were watching from the window. The next day, the atmosphere was strange. Whispering. At lunch, Julie cautiously asked, Do you have a man? We saw you get into a car yesterday. I was confused. What to say? I mumbled that he was an acquaintance, but Julie knew. It was not just any patient. It was Victor Morrison, who had been coming for 6 months. I couldn't deny it. I said yes. We are dating. Julie was surprised. With a patient? Yes. But we started dating after the treatment was completely finished. Julie had a complicated expression on her face. Within a few days, all the nurses knew. The looks changed. I heard whispers. Doctor with a patient. Period. 12 years apart. Period. I heard everything. It hurt. Mid-September, one nurse submitted her resignation. I asked why. She cautiously told me personally. She was uncomfortable that I was dating a patient. It felt awkward to work. Shock. I explained that we started after the treatment, that while he was a patient, nothing happened. But she shook her head. He was still a patient. And the age difference. I asked her to stay, but she had already decided. 2 weeks later, she left. I told Victor. He felt guilty. He said because of him, I was having a hard time. But my heart was heavy. A few days later, my daughter Anna called. I told her there was a man in my life. Anna was surprised. Who? A former patient? We started dating after the treatment ended. Anna was silent for a long time. She asked his age. I said, 58, 12 years older. Anna was surprised. 12 years? Almost a grandfather. I said, don't talk like that. Anna kept asking, is it normal to date a former patient? What will people say? I said it's normal. The treatment is over. But Anna was worried. She said she wanted to meet him. I agreed. I hung up and cried. The next day, I met Victor. I told him about Anna. Victor lowered his head. He said his son reacted similarly. He said it was strange that he was dating a 46-year-old. The son saw the 12-year difference, and that she was a doctor. We were silent for a long time. Victor spoke first. Is this hard for you? Yes. I denied it, but it was hard. A nurse quit. My daughter is worried. Victor took my hand. I am old. I am sorry. Age doesn't matter, I said. But to other people, it did matter. 12 years, doctor and patient. I thought for several days. Can we continue? Can we convince everyone? Victor also seemed to be thinking. The phone calls became fewer, the meetings fewer. End of September. Victor said seriously, we need time to think. Let's be apart for a while. My heart tightened, but I understood. I said, okay. From that day, contact became rare, a text once a week. How are you? Fine, that was it. A month passed, end of October. I missed Victor. I cried every night. Last week of October, Anna came home. Mom, how are you? You look terrible. I said fine. But Anna knew. Did you break up with him? No. We just took a pause. Anna asked, did you really love him? I said, I really love him. Anna thought for a moment and said, I want to meet him since you love him so much. I cried, I thanked her, I called Victor. For the first time in a month, I said my daughter wants to meet you. Victor was surprised. Really? Yes. Let's meet the three of us on the weekend. Victor cautiously agreed. We met on the weekend, Victor and Anna. Awkward at first, but Victor was kind to Anna. He asked about her interests, what she liked. How are your studies? Is it hard? Anna gradually opened up. After dinner, Anna said, he seems like a good person. The age difference is there, but I can feel he is sincere. If mom is happy, that is what matters. I cried. I said thank you. November passed. December arrived. Victor and I started seeing each other again. Now more confidently, we don't care what others say. The main thing is, we are happy. The last week of December, Victor suggested a special date, an observation deck. The Boston Skyline Observatory, a beautiful view. We looked at the night city. Victor took my hand and got down on one knee. People were watching. Dr. Emily Roberts, will you marry me? He took out a diamond ring. I cried. At 46 for the first time, a moment like this? Yes, I agree. Victor stood up and hugged me. People applauded. 1 year passed. I am 47. Victor is 59. We are married. I still run my clinic. Victor still runs his company. But now, we live together in Victor's apartment. We wake up together and come home together. Anna now gets along well with Victor. Last month, we had dinner with Victor's son's family. His grandson is adorable. Victor adores his grandson. We are happy. I am happy. My husband is 59 and I am 47, 12 years apart, but we are just a loving couple. The patient from the treatment room, 58 and 46. At first, other people worried, but we were sincere, and that sincerity created our happiness. Age is just a number. Patient and doctor, it doesn't matter if you are sincere. Love has no form. What do you think? A dentist and a patient, 46 and 58, 12 years apart. Love that began with the words, open your mouth. Do you support it or are you against it? Write in the comments. If you are hesitating because of age or relationships or what other people think, take courage. If you are sincere, age and status do not matter. Love boldly. Thank you for listening, subscribe, and like. That is a big support. I will return with a new story.